Hello, my dear friends. Welcome to my channel, Anjali's MedSphere. So, I'll share a story regarding Ananya. Ananya was a very independent girl, very strong girl, and then she does everything by herself. But one fine day, she was not able to stand by herself. She felt a very heaviness on her legs, and she felt like, what is happening with me? And she felt like, some energy, all of her energy was stolen away. She felt fatigue. Initially, she thought it might be too much work, too much stress. That might be the reason. And it continued. She went to a doctor, and the doctor diagnosed it as multiple sclerosis. It's very sad. So, today I'll be discussing about multiple sclerosis. Welcome to my channel. Multiple sclerosis was first described in 1868 by a French neurologist, Jean-Martin Charcot. As the name indicates, you can see multiple sclerosis. There will be numerous sclerosis or lesion, presence of lesions in the white matter of brain and the spinal cord. That is how the name came, because there is multiple जगह पे sclerosis हो रहा है. So that is how the multiple sclerosis name came for this disease. And it was coined by, or it was explained or described by the Jean-Martin Charcot in 1868. So to define multiple sclerosis, it is very chronic. It is a chronic disease. It is an autoimmune disease affecting the central nervous system. And how it is causing, or what happens in the central nervous system, is inflammation will take place, and that will lead to demyelination, disruption of the myelin sheath, and then to gliosis, scarring, or the plaque formation, and finally the loss of neuron, loss of nerve cell resides. So to define, multiple sclerosis is a chronic autoimmune disease affecting the central nervous system, and it is characterized by inflammation, demyelination, gliosis, and neuronal loss. You can see in this picture how a neuron is and what all are the parts for the neuron. Before knowing about the bigger anatomy behind the neuron, we have to know about the myelin. Think of a nerve like an electric wire. Like in electric wire, over the copper, there is the insulated electric, the insulation, plastic insulation is there. The material is there over the copper. Likewise, in a nerve or in a neuron, there is over the axon, there is the myelin sheath, which is like an insulation around the wire, isn't it? So in healthy neurons, this myelin will allow the passage of nerve signals to travel quickly across the body from the brain to the other parts of the body. When myelin is damaged, communication between the brain and the body is disrupted. So that is the importance of myelin. Types. In multiple sclerosis, mainly there is four types: clinically isolated syndrome, relapsing remitting multiple sclerosis, secondary progressive, and primary progressive multiple sclerosis. In clinically isolated syndrome, there will be a single episode of neurological symptom, and it can last up to 24 hours. And it might be developed into a full MS, otherwise it might not develop. It is a chance. It can develop into, or it cannot. Relapsing remitting multiple sclerosis. It is one of the most common type of multiple sclerosis. About 85% of the cases are this. It involves, there will be a flare up, there will be a relapse scene, and followed by a recovery phase. So there is relapses and remission in the relapsing remitting multiple sclerosis. And it is the most common kind of multiple sclerosis seen. Secondary progressive multiple sclerosis, it often develops after a relapsing remittent multiple sclerosis. Symptoms steadily worsen over a time, with or without occasional relapse. Here the symptom is steadily worsen, and there will be a prior already an episode of RRMS. So that is a secondary progressive multiple sclerosis. In primary progressive multiple sclerosis, there is no flare up or no remission. From the beginning, there is a steady decline in the neurological function decline of patient. There will be a steady decline in the patient's neurological function from the beginning. There is no period of attack and period of remission and all. That is the primary progressive multiple sclerosis. So these are the four main classification for the multiple sclerosis. Causes and risk factors for this disease. There are environmental. We can classify the cause and the risk factor into three. That is environmental factors, genetic factors, epigenetic factors. In environmental factors, infection, a recent infection with Epstein-Barr viruses or any human papilloma viruses or deficiency of the vitamin D, obesity, because already an inflammatory environment is there in a patient or person with obesity. So it all happens due to an inflammatory response change inside our brain. Physical activity, smoking will progress or exacerbate the symptom of the multiple sclerosis. And in Epstein-Barr or vitamin D, why? Because vitamin D is necessary for for the immune system. In order to prevent infection, in order to fight against the infection, this has a vital role. This vitamin D has a vital role. When there is a deficiency in that, the immunity can't be maintained inside our body. That is weakened. That is why this vitamin D is a risk factor for multiple sclerosis. Genetic factors such as the HLA-DR15, interleukin-2RA, HLA-DR16, any genetic mutation with any of these genes can also develop or there act as a risk factor for developing the multiple sclerosis. Epigenetic factors means hereditary factors. And one other risk factor is the gender. Especially this multiple sclerosis is incidence is seen in a female, especially in an age group of 20 to 40 years of age. So these are the risk factor or the cause for the multiple sclerosis disease. Pathophysiology. To describe or to explain the pathology behind the multiple sclerosis, due to the etiological factors that we discussed now, it can be any environmental factors or any infection, deficiency or obesity or any genetic mutation or what all the etiology that we discussed, that will lead to or that will stimulate the auto immune response. Whenever our any antibody is developed as a result of any infection, our body will develop an antibody. So this antibody doesn't know what is the healthy protein and what is the other one, so that will normally attack our cells. So here what happens, it will stimulate the autoimmune response. As a result of that, it will stimulate the T cells, B cells, and that will secrete the cytokines, and it will activate the microglia, macrophages. These are the immunity cells. All these cells are stimulated or activated, and this will produce this kind of cytokine. And anyhow, from the periphery system, this will cross the blood brain barrier, and it will reach the central nervous system, and inside the central nervous system it again cascades the inflammation process that will disrupt the myelin sheath. When the myelin sheath is disrupted, we know that the presence of myelin sheath will help in the normal transmission of the electrical and the chemical imbalances between the neurons. So the nerve conduction is impaired when the myelin sheath is disrupted. That will again, this disruption will invade the axons and the cells, and somehow the oligodendrocyte which is present on the neurons, that will try to compensate this with their healthy state, but eventually that cells also will lose their functionality, and finally what happens, this will lead to scarring, otherwise known as gliosis or the plaques or lesion. All these are pointing the same thing only. The scarring is only what they are like shown as lesion or plaques. So it finally reaches into that stage. It is seen in the white matter of brain and the spinal cord, and finally neuronal loss results. So this is the pathophysiology behind the multiple sclerosis. Clinical symptoms as a result of this pathology, pathogenesis behind that is happening inside the brain. So there will be, the patient might be having a numbness, weakness, cramping, lack of coordination. Primarily, as I said, fatigue. The patient has fatigue. Severe energy loss will be there. They might be not knowing why this fatigue. Fatigue is very normal nowadays, but sometimes it can be a symptom of this kind of deadly diseases. Blurred or double vision. If the myelin sheath over the optic nerve is inflamed, then that will affect the vision. So blurred vision, double vision, blindness can result. Muscle weaknesses. Why that is why the fatigue exists. Difficulty in walking, coordination problem, dizziness can be there. They have a difficulty in swallowing food. They will be having difficulty in speech, slurred speech, stuttering can be there. They will lose the sensitivity to pain, because the electrical impulses, no normal impulses transmission is not happening properly. So tinkling, burning, numbness, pins and needles. Urinary tract infections such as lack of control over the urination. So these are the depression, mood will be affected, cognitive impairment, unstable mood can be there, memory and concentration problem will be there. So these are the symptoms of multiple sclerosis. To diagnose this multiple sclerosis, history collection for every disease, for any disease, we will do the history collection, isn't it? History collection is there. We will get information from the history collection only whether there was any recent infection, any infection or any fever or any kind of morbidity in patient. Physical examination and neurological examination mainly will help us to understand whether the patient has any muscle problem, any walking problem, any coordination problem, balance problem, vision problem, speech problem, how the nerves are affected. No? Nerve examination, all the cranial nerve examination will be done in neurological examination, and also how their power, the muscle power, their tone, their reflexes can be exaggerated. So this can be understood from the neurological examination. The tests such as the MRI will show the lesion or the plaques inside the brain, inside the white matter of the brain or the spinal cord. Evoked potential tests to determine or to detect the velocity or the signal transmission along the nerves to the brain, and the spinal tap to rule out the CSF content, how it is, the cell count. All these can be got from the spinal tap CSF analysis. Vision test to rule out whether any vision problem that is due to the inflammation of the optic nerve. So these are the diagnostic investigation that will help to rule out or to diagnose the multiple sclerosis. Treatment. So treatment goal, there is mainly three main goals in our treatment: to treat the relapse, to treat the acute attacks, and to slow the disease progression, because there will be disability chances. So we have to slow that process and manage the symptoms conservatively, and we have to improve the patient's quality of life. They should lead a better life. No, they have to accept it, this disease, and there will not be any cure. So they have to accept it and live with this productively. So that is the treatment goal. Treatment of acute relapse. And multiple sclerosis relapse is the appearance of a new neurological symptom or worsening within that is lasting for more than 24 hours. So we will be giving high dose corticosteroid like methylprednisolone, an adult dose of 500 to 1000 mg IV. It is given once daily over 3 to 5 days. On a continuous 3 to 5 days, we will be giving methylprednisolone IV. So that is one drug of choice to like reduce the inflammation. And the plasmapheresis. After the methylprednisolone, then plasmapheresis is there. Plasmapheresis is a process where the blood is collected from the patient's body through a catheter or the needle, and it is transported into a machine where the plasma and the blood is separated, and the plasma contains all the harmful antibodies and toxins. So it is removed through the process such as the centrifugation, infiltration. So then it is removed, and it is discarded. The remaining blood is mixed with the replacement fluid, such as it can be saline or it can be any albumin, and it is then mixed and it is again replaced back into the patient's body, and then the symptoms will improve because all the toxins and antibodies that is attacking the patient's normal tissue is removed. So they will get a better relief. The second treatment is the modifying therapies. This reduce the relapse frequency. In between the attacks can be there. So we can reduce the frequency of these attacks, new lesion formation, and also the disability progression. It might anyway it leads to the disability in patients. So that progression can be delayed with this modifying therapies. It is there in injectable form, oral medicine form, and infusion therapies. Injectable such as the interferon beta, glatiramer acetate. And in oral medicines, they are providing dimethyl fumarate and teriflunomide. Infusion therapy, we have the ocrelizumab and almetuzumab. So these are the treatment option for modifying therapies for the multiple sclerosis. Other symptomatic management include muscle stiffness, spasticity management with stretching exercises, physiotherapy. In physiotherapy, there is stretching exercises, strengthening exercises, range of motion exercises, flexibility exercises, and the spasticity is reduced with the baclofen. Tizanidine tablets can be given. Pain is managed with gabapentin or pregabalin. Bladder problem is dealt with pelvic floor exercise. Pelvic floor exercise can be taught to the patient how it should be done, and how many times it should be done. Bladder training steps can be shared. Fatigue is managed with a regular, adequate exercise and good sleep. Depression and anxiety, unstable mood is a symptom in multiple sclerosis. So that can be dealt with medication, proper counseling therapies, sessions. So these are the management for symptoms, other symptoms. Another treatment on a longer run, since it is chronic and the progression of disability is on the other end, we will focus on the physiotherapy for the patient, occupational therapy. In occupational therapy, like training with a kind of occupation that will help in the patient for leading a daily living with that. Speech and swallowing therapies, cognitive rehabilitation for their improving their mental activity, mobility aids if it is needed, any crutches, any wheelchairs, what all the mobility aids they needed, that can be motivated or information can be given for that too. Lifestyle measures for better working of their life or better daily living, exercises, stop smoking because smoking can exacerbate the symptom or contribute to the exacerbation of the multiple sclerosis, balanced diet, proper adequate sleep routine, stress management, and supplements such as vitamin D. So these are the treatment setup or treatment for the practiced for the managing the multiple sclerosis. So to conclude, multiple sclerosis is a chronic disease where our own immune system attacks our own myelin sheath, which is very necessary, which is a outer covering of our neuron, which is very necessary for the transmission of impulses between the neurons to other parts of the body. So there is no permanent cure for this disease. That is what we learned from here. There is no permanent cure for this disease. We can only slow the progression. We can only reduce the frequency of the attacks and also improve the quality of life of the patient. So we can conservatively manage the patient and rehabilitate the patient for a quality and productive life. That is the only thing we can do with this disease. So accept it and live with it. Thank you. Hope you all understood this topic. And we discussed what is multiple sclerosis, what are its causes, and what is myelin sheath, what all are the pathophysiology behind the multiple sclerosis, what all are the types, how we can manage, what all are the investigation, and how we can manage this multiple sclerosis. And if you have any queries, please feel free to comment. And if you like my video, please subscribe, share, and like. Let us soon see in another video with another topic. Thank you so much.